Excuse me. Okay. So again, for this morning, we will be discussing non-communicable diseases. Okay. So namely, these are the following. So we have myocardial infarction, diabetes mellitus, chronic kidney disease, liver cirrhosis, peptic ulcer, pancreatitis, and celiac disease, and also PKU. Itong si PKU, if you will allow me, skip ko ito siya. Anyway, this is the last part. I was already able to discuss that one in a previous lesson. Okay, I think sa midterms na discuss ko na ito. Okay, so there will be some slides that are showing yung mga sample meal plans. So I will just skip over those parts. Okay, so that I will be focusing on the essential content for the lesson for this morning. Okay, so let's start with myocardial infarction or your MI. Okay, so ito siya, medyo may special significance ito sa akin because this was what my dad died from years ago. Okay, so ito siya. Okay, so when we say myocardial infarction, okay, so this is related to the cardiovascular system. Okay, so um, okay, so myo stands for muscle, cardial pertaining to the heart, and then when you say infarction, it is defined as tissue death due to lack of oxygen supply. And we know that if there is a lack of oxygen in any of our essential or major body organs, then this will lead to damage and then death. Okay? So in layman's terms, itong si MI is more commonly known as heart attack. Okay? So this is the most common form of coronary heart disease. Okay? Men are more commonly affected compared to women, and then incidence typically occurs in the 40s and the risk increases with age. However, um, lately, no, MI has been um, a lot of younger people have experienced MI. Okay? So usually due to lifestyle, stress. Okay? So wala itong patawad. Basta with regards to cardiovascular disease, napaka-tridor niya. It can attack the elderly population, and it can also strike in the younger ones. So we really have to be very, very careful lifestyle with our lifestyle practices, particularly with our diet. Okay? So it has multiple genetic and acquired risk factors. So with regards to diagnostics, so definitely we have the 12 lead ECG. Okay, so ito siya yung electrocardiogram. Okay, so this will touch a bit on ER nursing and ICU nursing. Okay, so this diagnostic test will show or will present the heart activity, okay, yung heart conductivity. It will show the different heart rhythms. Okay, next you have your echocardiogram or simply known as the ultrasound of the heart. We also have biochemical markers like CAMB, troponin T, and troponin I. So elevated levels of these biochemical markers will indicate myocardial infarction. Okay, and then another diagnostic exam will be your cardiac catheterization. So mag-insert sila ng fine tube into the vessels of the heart to check if there are any blockages. Okay, so for common risk factors, these include hypertension, diabetes, okay, hyperlipidemia, and family history of heart disease and drug and alcohol use. Okay, plus extreme stress, especially when it comes to emotional and psychological stress. Okay, so back with my dad. Okay, so 67 years old siya that time, but then if you consider, yung German lifespan, most German people can live as long as 80 plus to 90 plus. Yung what happened to my dad was a result of stress. Okay, so yun yung story niya that time. And I was quite young, 8 years old ako noon. Okay, um, so yung mga signs and symptoms, what I can remember, angina. Okay, so itong si angina, it is a discomfort or chest pain, tightness or pressure in the center of the chest. Okay, and the universal sign you would see in people suffering from myocardial infarction or heart pain, you would really see them putting their hand over their chest. Now, you will also notice, or the patient would also manifest pain or discomfort in other areas. So this is what we call radiating pain. So it could happen in the left shoulder and arm, the back, neck, jaw, and stomach. Okay. Next, we also have difficulty of breathing and or shortness of breath, cold sweat, and then dizziness as well. Okay, so you have to watch out for those signs and symptoms. Okay. In addition, heartburn. So ito siya, um, this could be tricky. Okay, so you might have a patient who is manifesting dizziness, radiating pain, tapos ang complaint lang niya is heartburn. Okay, so you have to watch out for that complaint because that could also be an indication of heart attack. Okay, next you have nausea and vomiting, and then rapid, irregular heartbeats. Okay, and would also like to add pallor. So, napaka-pale nila. Okay, so um, those are the signs and symptoms that you have to watch out for in people experiencing MI. Now there are less typical symptoms of MI in women. So, if you compare MI in men and women, for the female population, they tend to be more tolerant of pain. Okay, so they tend to manifest or report late signs of myocardial infarction. Okay, so they also have these atypical or less typical symptoms of MI, and we have extreme or unusual fatigue, upper back and shoulder pain, and sleep disturbances, and digestive issues. Hala, murag naman isa ako ah. Okay, so please take note of the signs and symptoms. I-erase ko na lang ito siya. For those who may want to take a screenshot, okay, so please do. But anyway, I will be posting this naman on Quipper. Although hindi makikita yung mga side notes doon, may mga notes doon sa baba. Okay? Okay, now for the medical management, just a short intro or just for you to be familiarized with this. Okay, so we have IV nitroglycerin and IV morphine. Okay, so these are pain relievers for the chest pain associated with your myocardial infarction. Okay, so we also have the ACE inhibitors, fibrinolytics, thrombolytics, and anti-hyperlipidemics. Okay, so since you're taking your pharmacology, not going to dwell so much on this one. Okay. Next, we also have surgical procedures such as your coronary angioplasty. Okay, so we have the following examples or following forms. Okay, so we have balloon angioplasty. Okay, so with the use of a cardiac catheter, they will insert a fine tube into the vessels and then they will inflate it. Okay, so may balloon po sa loob. Okay, to make the blood vessel wider. Okay, to ease the blockage. Next, we have the coronary artery stent. So, iba yung forma niya. How do I explain this? Okay, so, um, hindi na siya balloon, okay, so para siyang ano, small, parang ano, Okay, wait. Meron siyang ano, yung small stick na may legs, tapos siya yung pang-expand sa blood vessel. Okay? Next, we have atherectomy, so the removal of the affected blood vessel. So there is a surgical removal of the blood vessel that has the blockage. And then we have the laser angioplasty. So the use of the laser to break to relieve the blockage. Okay. And then we have the major surgical procedure, which is the coronary artery bypass or your cabbage. Okay. Now, for the nursing management, okay, so perhaps for those who had their pre-clean, especially sa mga general wards in SPH, not sure if you may have encountered mga patients with cardiac conditions back then. But if ever you get the chance to manage a cardiac patient, then these are the nursing management strategies that you need to remember. Okay, so we have to assess for the history of illness. Usually, sa mga MI, there is always a precipitating event. Okay, so back when I was a student, during one of our case presentations, I think I forgot that rotation basta nasa ward kami. Okay, so meron kaming meron kaming group na they had a case presentation on MI. Tapos mother siya. Ang story ng mother na yon na heart attack siya because she was shocked because she found out that her child used the money she gave, yung pang tuition sana, yung panlaag. Okay, so, sino hindi ma-atake nun, di ba? So, fortunately, survived naman ang mother. Okay, so the mother just simply had medical management while in the ward. Okay, so again, usually may precipitating event before the heart attack. Okay? So next, we monitor for vital signs, especially blood pressure and pulse rate. Now, the general rule for this one, no, lalo na pag cardiac case, is to really do your vital signs monitoring religiously. Like I've said, any cardiac condition is napaka-tridor. So you really have to closely monitor your patient. Okay, next, you also administer medications as ordered. So the priority during an attack is pain management. And then for those medications under your pain management, you have your morphine and your nitroglycerin. Okay? So aside from the IV form for your nitroglycerin, meron din siyang patch. Okay? So you would place that over the chest area of your patient tapos gina-rotate siya. Okay? So you do not uh, place the place a new nitroglycerin patch over over the old site. Gina-rotate yun siya. Okay? And then a special precaution for that one is to never touch it with your bare hands. Dapat naka-gloves kayo. Why? Because you might get in contact with the nitroglycerin itself and nakakakos siya ng hypotension. Mahihilo kayo do not if you do not practice proper handling of your nitroglycerin patch. Okay? Next, we monitor for pain. So we quantify the type, characteristics, and the intensity of the patient's heart attack. We also do intravenous and oxygen therapy as ordered. So, di ba, when we talk about myocardial infarction, there is a disruption in the flow of oxygen in the heart. So, definitely your patient will be on oxygen therapy. Okay, so you give your oxygen therapy as ordered. Okay, according to the rate prescribed by the doctor. Because the catch with oxygen therapy is that when given in large or uncontrolled amounts, it can also lead to organ toxicity. Nakakakos din siya ng tissue damage pag nasobraan ng oxygen ang patient. So we call that oxygen toxicity. Also, next, we obtain diagnostics or monitor laboratory results Assess for warning signs of MI, including shortness of breath, dyspnea, and crackles. Next, we also weigh the patient because we want to monitor if the medication is effective on the patient. Okay, so dapat may relief of fluid retention, okay, from the MI. Okay, so next, we also provide opportunities for adequate rest and we initiate cardiac rehabilitation. So they, aside from physical therapy, they also undergo stress management, to name a few. Okay, so again, itong mga side notes dito sa baba. So the drug of choice for pain control is morphine. Okay? We also keep oxygen saturation above 94%, but generally 95 to 100% is the way to go for your O2 saturation. Okay, so here, okay, so in addition to my mentioning of weighing the patient, we need to prevent fluid overload in the patient because fluid overload can also put great stress on the patient's heart. And yung mga medications na ginagamit sa ating mga MI patients, yung effect din nila is to reduce the fluid overload or fluid retention in the patient's body. Okay, so um, again, it is a way to check for the effectiveness of the medication. So also to prevent fluid overload. Okay, so sa rehab na part, so rehabilitation may include counseling and retraining for physical activities. At 4 to 8 weeks after discharge, the patient should be able to resume normal daily activities. Okay, so common board exam question or common question that you might encounter sa mga exams ninyo, especially where um, myocardial infarction is concerned. Okay, so sometimes you will encounter patients who are quite active in their sex life. Okay, so they would ask, okay, when can I resume my sex life? No, so um, yung common na advice na binibigay sa mga ganun na patients is to let them have a flight of stairs na test. Okay, so if they are able to tolerate going up a flight of stairs, then meaning they can resume that activity. Okay, so we call that the stair test. Okay, so yung particular number of flights of stairs, I forgot the exact number, so I'll just get back to that to get back with you on that one. Okay. Okay, so for the dietary management, okay, so dito tayo magfo-focus. So for recommended diets for MI patients, okay, so we have low salt, low fat, and low cholesterol, but then high in fiber. Okay, so these are the following dietary management or dietary steps. So we have to advise the patient to cut down on salt, common table salt intake in the diet to avoid hypertension. Okay, so intake should not exceed more than 2 to 2.5 grams a day. Wrong granny, sorry. Next, you avoid foods rich in cholesterol, okay, so such as ground nut oil, butter, whole milk, eggs, and lard. Okay, so these are fats derived from pig meat. Tallow, okay, so fats derived from goat or sheep mutton. Oily fish, meats, and red meat. Okay, and all non-vegetarian food contain cholesterol in a varied amount. Okay, so next, you also avoid non-vegetarian food, especially red meat. Okay, so next we increase the intake of food that contain polyunsaturated fatty acids, so such as flax, linseed oil, which is the richest source for PUFAs. Other oils that contain your PUFAs or your PUFAs are soybean oil, mustard oil, and olive oil. As all oils are high in fats, its consumption should be limited. The intake of oil should not exceed 20 grams a day. Okay, next, Sesame oil and almond oil hinders the absorption of low-density lipoprotein, so it is advisable to replace other cooking oils by sesame oil. And definitely advise your patient to increase their intake of water. Okay? Also, advise your patient to take high fiber diets such as whole grains, bran, oats, and green leafy vegetables. Cut down the intake of sugar and other sweeteners. Avoid fat-rich portions of flesh foods. Instead, have lean meat. Okay? So, pwede naman siya magkain ng meat. Make sure na less ang fat content ng meat na kinakain niya. Okay? Avoid fat-rich desserts and fried snacks like cakes, pastries, and puddings. And instead of frying food, you can advise the patient to do boiling, steaming, grilling, or having their food roasted. And then avoid coffee and caffeinated drinks. Okay? So that's for your dietary practices for MI patients. Next, we also advise them to consume food that's rich in magnesium. Okay, so magnesium is central to the healthy heart rhythm because it's involved in transporting other electrolytes such as calcium and potassium into cells. Okay, so electrolytes are all important for nerve signals and the muscle contractions of a normal heartbeat. So yung mga magic name na electrolytes, so magnesium and also potassium. Okay, so we also need to monitor them sa lab results ng patient, sa blood chemistry. Okay? Just to insert din, when it comes to your monitoring of lab results, be also particular with the potassium content or potassium levels of your patient. Okay, so generally, 3.5 to 5.5 yung normal levels ng potassium sa human body. Okay, anything lower or higher than that can put your patient at risk for heart problems, specifically yung mga alterations in cardiac rhythm. Okay, so bantayan mo dyan ang patient with regards to potassium. Okay? We also advise the patient to increase the intake of vitamin C rich fruits, okay, such as your fruits, green leafy vegetables, okay, such as your cabbage, broccoli, and tubers such as potatoes and sweet potatoes. So, ang magical na kamote. Okay, and avoid eating junk food such as pizza, burgers, etc. because they contain a lot of sodium. Okay, so to add, yung sa vitamin C, bakit encourage ang consumption of vitamin C? It maintains the elasticity and integrity of artery walls. Okay? Next, we also advise the patient to resume calcium intake. Reduce but do not completely avoid calcium since it is also needed for maintenance of our body, especially of our bones. Okay, so examples, okay, milk and seafood, nuts, green leafy vegetables, whole grains, peas, legumes, and oil seeds. And also, patients should avoid custard apple and banana as they are high in calcium. So, why do we caution against high levels of calcium? It's because calcium deposits are part of artery clogging plaque. Okay? So, nakaka-contribute itong large amounts of calcium in the formation of plaque sa blockages within the heart. Okay? Specifically sa mga blood vessels. Now again, to sum up the diet plan for myocardial infarction, so we have the best heart-friendly foods to eat, lots of fruits and vegetables, lean meats, skinless poultry, nuts, beans, and legumes, fish, whole grains, laoy na egg, sorry. Next, plant-based oils such as olive oil and low-fat dairy products. Okay, so in the next slide, okay, so this is a sample one-day meal plan for myocardial infarction patient. patient. So you can go over this later on when you have the slides to yourselves. Okay, so that I can proceed to the next slide. Okay, so next we proceed to diabetes mellitus. Okay, so diabetes, okay, it comes from the Greek word meaning to flow through, and then your mellitus, it's a Latin word which means honey. Okay, so this is the disease wherein sweetness kills. Okay, so diabetes is a chronic or long-lasting health condition that affects how your body turns food into energy. Okay, so just a little pathophysiology on this one. So it's when your pancreas doesn't produce enough insulin to control the amount of glucose or sugar in your blood. Okay, so we have two types. So we have diabetes, like we have your DM type 1, your insulin requiring kasi walang insulin yung patient. Okay? Sa diabetes mellitus type 2 or your DM type 2, it is more of a lifestyle disease. May insulin naman si patient kaso it's not adequate for um, his or her sugar control. Okay, so most of the food that the patient eats is broken down into sugar and released into the bloodstream. So when blood sugar goes up, it signals the pancreas to release insulin. Okay, so you think of insulin as a key to let the blood sugar into your blood cells for use as energy. Okay, so in type 1, kasi walang insulin si patient, okay, so um, this is a time wherein makita nyo talaga your DM type 1 patient would exhibit weakness, okay, yung sleepiness, kasi wala siyang energy. Okay? But then, since hindi um, maabsorb ng cells ng body yung glucose, the glucose just simply stays in the bloodstream. And because of this, they would manifest or they would exhibit yung hyperglycemia. Okay? So glucose transported by the blood, it's entering to the cells is controlled by hormones. Okay? So itong si insulin, this is the hormone responsible for glucose transport. Okay, for converting it into energy. Okay, so this is what I've mentioned, yung type 1 and type 2 diabetes. Okay, so itong si type 1 diabetes, it usually attacks children and adolescents. Okay, so this is thought to be caused by an autoimmune reaction. So the body attacks itself by mistake. That stops your body from making insulin. So this is usually diagnosed in children, teens, and even young adults. As I've said, ito yung insulin requiring na DM type. Okay, so dito nafo-fall si Gary Valenciano. Okay, so yung typical na DM type 1 patient, payat payat sila. Okay? Where in contrast, yung type 2 diabetes, okay, so as I've mentioned, ito yung lifestyle based na diabetes mellitus. May insulin naman si patient but then it's either kulang siya insulin or his or her body has already developed a sort of insulin resistance. Okay, so either of the two. Okay, so the body doesn't use insulin well and cannot keep blood sugar at normal level. So this develops over many years and it is usually diagnosed in adults, but more and more in children, teens and young adults. So meron din tayong another type of diabetes which is your diabetes type 2 which is your juvenile onset na diabetes. Okay, so yung typical tsura or um, typical body description of your patient with DM type 2, they are more on the rounder side. Okay, so isipin nyo lang si Santa Claus. Okay? Malapit ng Christmas, no? Okay. Another type of your diabetes is your gestational diabetes. Okay, so ito yung diabetes ng mga buntis. Okay, so this develops in pregnant women who have never had diabetes. As in, wala talaga silang prior history of diabetes ever. Okay, the baby could be at higher risk for health problems. Why? Yung sa mga patients with GDM or gestational diabetes, babies are usually macroscopic or larger than normal. It's because of um, the ingestion of glucose. Okay, it travels from it passes through the placenta and the baby absorbs the excess glucose. So the more glucose, the bigger they get. Okay, and the problem there is that they are quite unsafe, or the it becomes risky for them to be delivered via normal spontaneous vaginal delivery. Why? Because sa sobrang laki ng baby, the baby is at risk for having shoulder dystocia. So kung maglabas si baby through the birth canal, may ipit yung kanyang shoulder. Okay, and that will cause injury. That is why, basta GDM ang patient, the ideal type of delivery is cesarean section. Okay, so that the baby will have less trauma, okay, upon delivery. Now, another complication of your diabetes, gestational diabetes, hyperglycemic ang mother as expected. But then, sa baby, they tend to be hypoglycemic. Why? Kasi na-activate early yung yung insulin, okay? In their bodies. Okay, that is why pag GDM ang patient tapos may baby sila, right after delivery, their blood sugar gets monitored. Okay? So we also have pre-diabetes. Blood sugar levels are higher than normal but not high enough yet to be diagnosed as type 2 diabetes. Okay, so para siyang trailer version na diabetes. Okay? Or teaser version na diabetes. Okay, so as for the symptoms of diabetes, okay, so we have the following. Your patient is always thirsty. Okay, so this is polydipsia. Polyphagia, always hungry. The patient will also urinate a lot, so that's your polyuria. Aside from this, we have blurry vision, vaginal infections, systemic weight loss, frequent urination, numbness or tingling in hands and feet, sexual problems. Usually, for males who are affected by diabetes, they have problems in maintaining an erection. Okay, so if you're handling adults suffering from diabetes mellitus, and that's one thing that they might really be concerned about. Okay, so you have to be ready with um, counseling as well. Okay? So, itong si diabetes, it has multi-organ effects. Okay? And if uncontrolled yung diabetes ng patient, these multi-organ effects will lead to complications. So, you have to watch out for eye health. Okay? Because, di ba, mag-travel si glucose, okay, around the circulation sa body ng patient. The stickier the blood, kasi yung pinaka hallmark or one of the main characteristics of diabetes, okay, blood wise, medyo malapot yung blood nila. And the thicker the blood is, they do not carry enough oxygen to the different tissues within the body of the patient. So pagdating sa eyes, no, so nakakadamage siya ng eyes. Okay, so poor ang perfusion. That is why your patient will manifest blurry vision. Next, another multi-organ or another multi-system effect of your diabetes is neuropathy. Neuropathy. Your neuropathy. Okay, so that you will often encounter patients who will complain of either numbness or tingling in the hands or feet. Okay, so we had a family friend before. Okay, so ang ang gi-manifest niya or ang na-exhibit niya was the numbness na part. Why? Because her diabetes got so bad, it already damaged her peripheral nerves. Okay, so particularly doon sa paa, doon sa feet niya. Okay, so there was a time that that this family friend, she went along with my mom for foot spa. Okay, tapos yung may paraffin wax. Yung si mama, feel niya yung heat ng paraffin wax. But then, si family friend, parang wala sa kanya yung heat ng paraffin wax. And that was how bad her diabetic neuropathy was back then. Okay? So we've already talked about complications involving the eye, so blurry vision, and also yung peripheral neuropathy. Okay, so another manifestation or complication of your diabetes is that they're often suffering din from hypertension. Okay, usually maka-partner yun siya. Okay, once your patient is diabetic, also expect or also anticipate na you will do monitoring sa kanilang blood pressure. Okay, so the thicker the blood, the more pressure it takes um, for the blood to circulate. Okay, so that is why my hypertension in diabetic patients. Okay. Now for medical management, so definitely your patient has to maintain blood sugar levels within the desired normal level. So they would use anti-diabetic drugs or oral um oral anti-diabetics. Okay? Itong COHA, ayan siya, I forgot the term for this one. The oral ayan, oral hypoglycemics. Okay? If I remember well. And definitely, they will use insulin, especially yung type 1 na diabetics. They also have to maintain healthy blood lipid level concentration, control of blood pressure and weight, and measures that can help prevent or delay previous diabetes complications. Okay, so that's your medical management for diabetes. Okay, so for diagnostics, okay, so we have the following. So we have your fasting glucose test or your FBS or your fasting blood sugar. So the normal range or the normal value for this one is less than 100 mg per dl. In pre-diabetics, it's 100 to 125. In diabetics, it's 126 or higher. Next, we have the random or anytime glucose test. So, ito siya, makikita nyo ito sa mga malls, 'di ba? May mga stalls or may mga salespersons promoting yung Glucerna, 'di ba? Yung mga milk for diabetics. Okay? So, doon sa stall nila, they offer yung free random glucose test. Okay? Itong si fasting glucose test, so from the name itself, your patient would have to be instructed to be on NPO for around 8 to 10 hours. Okay? So, depende sa protocol or depende sa gina-observe ng hospital. Okay? Next, you have your A1C test. So, in normal patients, that would be a normal result is less than 5.7%. In pre-diabetics, it's 5.7 or 6.4%. And in diabetics, it's 6.5% or higher. So, what is the significance of your A1C test? So, ito siya. It will simply test for your patient's compliance um, to diabetes management. Okay, so yung mga ito siya, yung mga normal values for your A1C test. Ito yung grade na dapat i-maintain ng patient for the A1C test or rather dapat ito yung target result nila. Okay, anything higher than that will tell the physician that poor yung compliance ni patient sa kanyang diabetes management. And then lastly, we have the oral glucose tolerance test. So this is commonly given to pregnant women. Why? To check for gestational diabetes mellitus. So how is this done? So medyo heg siya o medyo hago. Okay, so your patient will be instructed to drink a liquid that contains 75 grams of glucose. And then, um, the medyo inconvenient na part is that the patient will have blood drawn before the drinking of the liquid, and then again two times every 60 minutes after sa pagdrink ng liquid. Okay, so each time the blood glucose level will be checked. Okay, so they want to see if um carry ng body na um ma-regulate yung blood sugar levels niya despite the presence of the glucose containing liquid na na-ingest niya. Okay? Now, as for the nursing management, so you have to review factors in glucose instability and educate the client about diet, exercise, healthy lifestyle, and hyper or hypoglycemia. Okay, so for diabetics, either of the two can be quite life-threatening for them. So you have to teach them on how to monitor or how to recognize signs of both hyper and hypoglycemia so that they can promptly do the prescribed management. Okay, so pag hyperglycemia, okay, so um, medyo hot flushed sila. Okay, and then my blurring of vision. So, right then and there, upon checking the blood sugar, tapos if ma-discover nila na hyperglycemic nila, automatic they will have insulin, emergency insulin. Pag hypoglycemia, okay, so if, let's say, if the patient went into strenuous activity, tapos hindi siya nagkain ng maayos, okay, so your diabetic patient will still be at risk for hypoglycemia. And the antidote for this one is glucagon. If your insulin will reduce the amount of glucose, itong si glucagon will increase the level of glucose in the patient's body. Okay? Monitor VS, INO, and weight. We also discuss how the client's anti-diabetic medications work. We also check injection sites periodically for the client administering insulin. So itong si insulin, it is given subcutaneously. Okay? And we have a lot of subcutaneous injection sites in our bodies. Okay, so they need to be rotated. Why? Because you want to prevent tissue damage. Okay, or tissue um forgot the term again. Okay, basta it ends in trophy. Okay, so I'm just going to retrieve that. Okay. Again if ever you will encounter a patient who is diabetic in the ward tapos meron siyang scheduled na insulin injection, one of the things that you have to check for is, one of the things that you have to ask your patient is, where was the last site of insulin injection? So if mag-point siya to a certain part, definitely the next injection site will be different. So you just have to select another site for your insulin administration. Next, we also educate the client about home glucose monitoring. So we know that diabetes mellitus is a chronic disease. Okay, so when the patient will be staying at their respective homes, they also need to be empowered and educated well enough for them to take control of the disease. Okay, so the disease will not disappear 100%, but definitely the patient should know how to manage it. And it starts with home glucose monitoring plus the other diabetic management strategies. Okay, so turuan nyo sila kung paano um, magamit ng glucometer. Okay, usually pag may admitted tayo na diabetic patients, meron na silang personal na glucose monitoring device plus yung strips. Okay? But for those patients na they do not have their own glucose monitoring equipment yet, can always use the glucose monitor or the glucometer from the nurse station. Okay? Excuse me. Okay? So to continue, okay, so dietary management for diabetic patients. So we have high fiber diet. So the diabetic patient can still have a normal diet, but with increased fiber. So you can give them more whole grains, fruits, and vegetables. They also have to observe a low fat diet. So severely restricted fats allowed 10 to 15% of the total energy requirement. Then all foods rich in fats are not allowed or restricted. Foods cooked by a method not requiring the addition of fat. So if my fats naman, they have to use yung mga oils with less fat content. Okay? For food selection, okay, so you have to give skim milk, lean meat, cereals, fruits, and vegetables. And you also have to the patient also has to avoid fatty meals, rich desserts, and fried foods. Okay, so for milk, okay, so we have skim milk. So this is the milk from which the cream has been removed. So definitely no fat siya. Okay, so skim milk is safe for diabetic patients. Okay, other dietary management. So carbohydrate in the intake depends on the metabolic needs of the patient, the type of diabetes, or the degree of glucose tolerance and individual preferences. Okay, so the amount of carbohydrates ingested has the most significant influence on blood's glucose levels after meals. And the more grams of carbohydrates consumed, the greater the glycemic response. Okay, so yung mga foods rich in carbs, no? So definitely yung mga cakes, pastries, white bread, and even rice, no? So um, this can increase the glycemic response in the patient. So dapat i-reduce nila. Okay? So next, carbohydrate intake must be fairly consistent at meals and snacks. So this is to help reduce fluctuations in blood glucose levels between meals. Then carbohydrate foods must be given, okay, so that are low in GI effects, such as high in fiber foods like fresh fruits, legumes, and whole grains. Okay, so these types of foods have a moderate effect on blood glucose. Okay, next. Okay, so to continue with the dietary management for diabetics, okay, so you have to minimize foods and beverages with added sugar and excessive use of fructose as a sugar alternative. Sugar alcohols are also not recommended. Now, artificial sweeteners such as aspartame, saccharin, and sucralose contain no digestible carbohydrate and can be safely used in place of sugar. Okay, and again for alcohol with a daily limit of one drink for women and two drinks for men. Okay, so side notes. Okay, so with regards to alcohol, okay, so because although sugar alcohols such as sorbitol and mannitol have lower glycemic effects, their use has no significant long-term improvement on glycemic control. Now, the most common is xylitol, and it is the well-researched sugar alcohol. It's a common ingredient in sugar-free chewing gums, mints, and oral products like toothpaste. Now, why ginalimit dapat yung alcohol? Okay, so it's because alcohol can cause hypoglycemia by interfering with glucose production in the liver. 'Di ba pag damage ang liver ng patient, na-alter din yung glucose production niya. Okay, so once damaged si liver, what will follow is a hypoglycemia. Okay, that's why pag mga liver cases or yung mga patients with a history of damaged liver, monitor din yung kanilang blood sugar. Okay, excessive alcohol can also worsen hyperglycemia, and it can also raise triglyceride levels. Okay. Next, you have the dietary management, steps number 8 and 9. Still for diabetes mellitus, the patient should limit saturated fat intake to less than 7% of total kcal from fats. Okay? This is because people with diabetes are at high risk of developing cardiovascular diseases. Kasi 'di ba, I keep on repeating, sticky yung blood. Sticky ang blood ng patient with diabetes because of the presence of excess glucose. And because of this, poor perfusion will follow, and because of this, the patient will be at increased risk of developing cardiovascular disease. And then, ika-9, we give moderate protein of 10 to 15% of resting metabolic rate. So we give lean meat, fish, and poultry to avoid muscle wasting. Okay, so why are we particular for this one? It's because high protein intake or high protein content is detrimental to kidney functions, and we have to be particular din sa kidney function ng patient because in diabetes mellitus, one of the complications involve the multiple systems including the kidney. Okay, so once na natamaan ka ng diabetes, you want to make sure that you want to live a highly optimized life. Okay, and dapat you have to avoid or reduce yung complications. And having a strict or having a good compliance with the dietary management for diabetes mellitus, especially on the part of protein restriction, it can help your patient um, still cope well with the disease. Okay? Okay, can you give me a moment, please? I'm just going to drink some water. Okay? Perhaps 2 minutes. Pause ko muna. Okay, so thank you for waiting. To continue, we proceed with chronic kidney disease. Okay, so by definition, CKD is a condition in which the kidneys are damaged and cannot filter blood as well as they should. Okay, so yung pinaka-function ng kidneys natin, it filters out the waste products in our blood. And once our kidneys are damaged, it's a domino effect. Okay, so yung mga waste cannot be properly excreted, and it will be circulating around the body of the patient. Okay? And then, one of the telltale signs na nasisira na yung mga kidneys is if zero yung urine output ng patient. Okay? So, ito yung number one na gina-watch out namin back when I was still in SPMC sa gynae ward kasi yung common itong kidney disease, okay, or kidney damage in our gynae patients. It's because usually no yung mga patients suffering from ovarian cancer, cervical cancer, aakyat kasi yung mga cancer cells, and then they will attack the nearest major organs. Okay, so natatamaan yung kidneys ng patient. Okay? So once na matamaan yung kidneys ng patient, when if and when we assess or if we will notice that our patient suddenly doesn't have urinary output like for the whole 8-hour shift. That would give us a signal na may renal involvement na. And then usually, no, especially if the waste of the patient has an reach toxic levels, that's the time na the doctor will declare na dapat for dialysis yung patient, so that it will be the machine um, that will do the removal of the waste products from the patient's blood. Okay, so risk factors for your chronic kidney disease are the following. So diabetes, okay, high blood pressure, okay. Next we have heart disease. Having a family member with kidney disease could also put you at risk for developing kidney disease as well. Okay, so race-wise, okay, so being African American, Hispanic, or Native American or Asian, and being over 60 years old. Okay, now, because of this, excess fluid and body waste from the blood remains in the body and may cause other health problems such as heart disease and stroke. So imagine nyo lang na, aside from excreting the waste products of our blood, our kidneys are also responsible for maintaining fluid balance in our bodies. Okay, so another thing that I remember with our patients na natamaan yung kidneys nila, okay, back in the ward, they would have excess fluid in certain parts of their body, such as their legs and even on their abdomen. So we call that ascites. Okay, and as for the function of the kidneys, okay, so just for a recap sa ating anatomy and physiology, our kidneys are responsible for monitoring or controlling water balance, maintaining electrolyte balance as well, removing waste, controlling blood pressure, producing the hormone erythropoietin, and activating vitamin D. Okay, so as I've said, itong si kidneys, once they get damaged or they experience injury, it will be a domino effect in your patient. So, ang dami mga complications, side effects na makikita natin sa patient. Okay, so I'm also going to mention itong si erythropoietin. So this is the hormone responsible in signaling the production of red blood cells, okay, in the bone marrow. So pag may CKD or may kidney damage or injury yung patient, they would often manifest or exhibit pallor, na anemic sila. Okay, because of the lack of erythropoietin. A lack of erythropoietin will lead to decrease in production of red blood cells, okay, leading to anemia. Okay, so to address this, meron tayong subcutaneous na injection. Okay, we have the ipoetin alpha. Okay, so medyo social siya na syringe. It's a pre-filled syringe that's given to your patient around 2 to 3 times a week. Usually back in the ward, it's given every Wednesdays and Sundays, and it's a synthetic form of your erythropoietin, so that it will help your patient produce more red blood cells. Okay. Another thing that you would notice in your kidney damaged patients, they will also manifest bone weakness, bone damage. Why? Because they do not have enough vitamin D as well. Okay, so itong si vitamin D, makapartner sila ni calcium. Okay, so usually, no, yung mga medications that you will see in your kidney patients, meron talaga silang mga calcium supplements plus vitamin D. They also have ferrous sulfate to deal with the anemia. Okay, so very wide, very extensive um, yung medical treatment ng ating kidney damaged patient. Now, for signs and symptoms, your patient may exhibit itching, muscle cramps, he must nausea and vomiting, not feeling hungry, swelling in the feet and ankles. So this is coming from the fluid imbalance. Okay? Too much urine or pee or not enough urine. Usually, no, ang nakikita ko sa patient is zero urine output. Okay? Trouble catching your breath and trouble sleeping. Why? Because, di ba, I mentioned that your patient with kidney disease has problems regulating or maintaining fluid balance. So aside from from the excess fluid traveling to the legs and to the abdomen, this can also cause pulmonary congestion. Or naiipit din yung diaphragm ni patient, especially in cases of extensive or full-blown na ascites. Okay, so talagang malalaki yung mga tiyan ng mga kidney disease patients. Okay, so imagine nyo lang yung large amounts of fluid staying in your abdomen. Okay, so the more fluid they have in that area, may ipit yung diaphragm nila. And they would all often experience difficulties in breathing. Okay, so I remember so many patients, yung mga elderlies na nagsuffer from cervical or ovarian cancer, tapos umakyat sa kidney, tapos very pronounced ang kanilang ascites. Hindi talaga sila pwede mag-lie down flat on bed. Why? Because their difficulty in breathing will be worsened. So, dapat naka-upright sila. And aside from this, so, no, it's quite difficult for them to get intubated kasi there will come a time wherein their breathing becomes quite affected. So they would tend to experience cardio and respiratory failure, especially pag nasa end stage na um, end stage na yung kidney disease nila. Okay, and then their heart and their lungs start failing. So usually, no, one of the most difficult cases na basta kidney disease ang patient, they would really need to undergo intubation. And mind you, they are quite difficult to intubate. Why? Kasi hindi na sila pwede lie down flat on bed kasi all the more sila mag-difficulty in breathing. However, I remember there was this one internal medicine na resident, kaya good niya mag-intubate na naka-upright ang patient. Tapos, very, ano siya, kanang petit na doktor. Tapos, nag-intubate siya while having the patient sit upright. Tapos, ang laki-laki ng patient. So, amazing yung ano ni doc. Okay. Next, some other health consequences of your CKD include anemia. Okay, so I already mentioned this one. Increased occurrence of infections. Okay, low calcium levels and high phosphorus levels in the blood and high potassium levels. So mga electrolyte imbalances, loss of appetite or eating less, and depression or lower quality of life. Okay, so very poor ang prognosis basta chronic kidney disease. And then it's also one of the worst deaths I've witnessed. Okay, so once na you have a patient with chronic kidney disease, tapos nasa end stage renal disease, it's one of the worst ways to die kasi um, because of the pulmonary congestion, they're always talagang in pain sila in the last hours, last few minutes of their lives. Kasi hirap na hirap sila huminga because of the fluid circulating in their bodies. Tapos nag-experience sila ng pulmonary congestion. Okay? Next, okay, so ito yung mga side notes. Okay, so in CKD, the kidneys cannot remove phosphorus very well. Okay, so high phosphorus levels can cause damage to one's body. Okay, pulling out calcium out of the bones, making your patient weak, and that is why they often have calcium supplements. Okay, there's also high potassium because the kidneys cannot remove the extra potassium in the patient's blood. So instead of leaving the body through the urine, the extra potassium in the blood travels to the kidneys and back into the bloodstream. So, di ba, I mentioned 3.5 to 5.5 yung normal serum level ng potassium sa ating body. Okay? So, any increase in this one, especially if mag-reach siya ng 6 and above, sorry, it will let your patient to be at risk of having faulty or dangerous cardiac rhythms. Okay, so atakihin talaga sila sa puso because of the increased potassium in their bloodstream. Okay, so bantayan nun jud ang patient na with CKD. Okay, so now for diagnostics, okay, so we have the following. So, GFR for your glomerular filtration rate. We also have uh, we also have um, blood chemistry such as your creatinine and your BUN. Itong si BUN and si creatinine, these are the waste coming from our um, waste products ng ating body. Okay, so having elevated levels of these lab results will indicate kidney damage. Okay, so okay, that's just a backgrounder sa mga diagnostic. Okay, so just to be familiar with the common na kidney function test. So again, GFR, your glomerular filtration rate, and then your BUN and creatinine. Okay. We also have a urine test or urinalysis to check for the presence of albumin. So albumin is a protein that can pass into the urine when the kidneys are damaged. Okay, so once the kidneys are damaged, di ba, masisira yung kanilang filtration ability. Na itong C protein, by nature, they are they have a protein has large molecules. And then once na masisira yung filtration function ni kidney, itong si protein um, will go past the kidneys. It will be excreted through the urine where they should not be in the first place. Okay, that is the essence of having a urine test. Kasi once na you do your urine test on your patient and then you were able to see that there's a presence of protein or albumin, that will be already served already as a warning sign na your patient's kidney is damaged. Okay? So this is your type of urine test. Okay? So for those na dumaan ng CHN, definitely nagka-try na kayo nito. Okay? So urine test. Okay? Yung color na strip. Okay? So urine to albumin to creatinine ratio, again, this is another diagnostic test for your kidney function. I'm not going to dwell much on this one. Just go over this on your slides when you have time to go over your slides. Okay? So for management of your CKD, control blood pressure within normal limits, meet blood glucose goal if your patient is diabetic. So 80 to 120 yung gold standard. Next, take medicines as prescribed, which depends on the cause. For example, hypertension. And then antihypertensive medication if diabetic, then insulin or oral hypoglycemic agent. Ito yung meaning sa OHA before. Okay, so I got it partly correct. Okay, so oral hypoglycemic agent. Okay, so or your OHA. Yung mas ginagamit ko kasi is oral anti-diabetic meds. Okay? The most important step that you can take to treat kidney disease is to control blood pressure. Why? Because high blood pressure can damage your kidneys. Okay? So good blood pressure control is essential. Next, we work with the dietitian to develop a meal plan for the patient. We also let them have physical activity as part of their daily routine. Aim for a healthy weight, get enough sleep, stop smoking, and find healthy ways to cope with stress and depression. Okay? Now, for the dietary management, okay, we have a high-calorie diet or your Harris-Benedict equation. So, for the equation for meals, the BMR is um, computed. So, kilocalories per day. You have 66.47 plus 13.75, ito yung mga constant, times the weight, and then yung ano, height, okay, height, and then age. Okay? And then different yung equations for males and females. Basta important is remember yung ano niya, yung mga constant values. And yung mga important measurements, or important numbers, weight, height, and age. Okay? Okay, so this is more on the dialysis, more on renal nursing or dialysis nursing. Just simply be familiarized with this one. Okay? What's important is to remember the constant, tapos um, yung mga essential numbers involved here. Again, it's your weight, height, and age of the patient. Okay, so you can go over this step by step when you go over your slides. Okay, okay, so the essential part of our discussion here for CKD is your dietary management. So give hard candies, honey, and jam, and PUFA salad dressing, and soft mayonnaise. So again, your polyunsaturated fatty acids. So the purpose of these is for weight maintenance, prevent wasting, prevent malnutrition, and to increase energy content of food. So, di ba, yung mga patients natin with CKD, they often manifest or exhibit yung poor appetite or decrease in appetite. So you can give them hard candies, honey, and to stimulate yung appetite nila. Okay, and to also prevent wasting or malnutrition. Okay, diet wise, okay, so low protein diet. So give between zero point 0.6 to 0.75 grams um, per desired body weight. Okay, and 50% of protein or total energy requirement should be coming from high quality products such as eggs, milk products, fish, and soybeans. Okay? Napapansin ko din no, sa mga CKD patients, they also include the egg yolk or the egg white. So this is limited to 2 to 3 times per week. It's because it is a good source of albumin. Okay? So ito siya. Okay, so the main purpose of the dietary management of CKD is to slow the progression of renal disease, and low protein produces fewer nitrogenous waste and will reduce the risk of uremia. Okay, so the lesser the protein, the lesser the uh, waste. Okay, the waste that was not filtered by the kidneys. Okay, and we also reduce the risk associated with hyperphosphatemia to ensure an adequate amount of okay, ito siya. Wait, forgot the whole for this one. Okay, wait a while. It's in my notes. Okay, it means essential amino acids. Okay. Okay, other guidelines. Okay, so saturated fat, cholesterol, free diets. Okay, so the management, we provide unsaturated fats such as nuts, seeds, and polyunsaturated fatty acid salad dressing and mayonnaise, avocado, soybean products. Okay, to control elevated blood lipids and reduce heart disease risk. Okay, sodium should also be restricted. So, restrict up to 2,000 milligrams per day. So, hindi sila pwede sa mga canned or cured or processed foods which use salt and sodium-containing flavoring agents and preservatives. Salt, fish sauce, and soy sauce are omitted from the table or on the patient's tray. Okay, so we have this dash. Okay, so dietary approach to stop hypertension. So, matik, basta hypertension, low salt, low fat. Okay? Okay, so for your DASH diet, it's rich in fruits, vegetables, low fat dairy products, whole grains, fish, poultry, beans, seeds, and nuts. It is low in salt. It is low in salt and sodium, added sugars and sweets, fat and red meats. It's known for the treatment of hypertension, heart disease, and kidney disease. And another thing for your CKD, we also observe fluid restriction. Okay, so fluid is unrestricted if the urine output is normal, but if it is not normal, then fluid restriction should be 1,000 ml per day plus urine output to regulate fluid and electrolyte imbalances. Usually, no, hindi sila naka-dextrose. Yung ating mga CKD na patients. Kung naka-dextrose man sila, the rate of their IV is KVO. Okay, so keep vein open. That's 10 cc per hour. So in a minute, typically 2 to 3 drops and makikita ninyo. But if, kung wala naman siyang, IV line, but then meron siyang heplock. Okay, so may IV access naman tayo, but then there is no tubing. Okay, so that's what your heplock is for. Okay. Additional dietary management, so phosphorus and potassium restrictions. For the phosphorus restriction, large amounts of phosphorus are found in dairy products such as milk, cheese, yogurt, and ice cream, pudding, nuts and peanut butter, dried beans and peas such as kidney beans, split peas and lentils, beverages such as cocoa, beer and dark cola drinks, brand breads, bread cereals, and processed convenience and fast foods. Okay, so hindi ito sila pwede sa CKD na patient. So if ever you encounter a CKD patient and then he or she requests for cola, even chocolate or coffee, no yun po sa kanila. Okay? Hala, sorry. Okay? Again, ito mga side extra notes. So, eating high phosphorus foods can raise the level of phosphorus in the blood, and the kidneys may not be able to remove all of the extra, all of this extra phosphorus, and this may lead to hyperphosphatemia. Okay? So, yun. Okay. So for the calcium, I already mentioned this in the other slide. Okay. So, kidney disease may cause serious problems such as damage to the heart and other organs, poor blood circulation, bone pain, skin ulcer. So, everything that should not be seen in a healthy patient, yan yung i-avoid natin. Okay, we have to prevent those complications from happening if we have a patient suffering actively from chronic kidney disease. Okay, and in relation to phosphorus, okay, keep phosphorus at safe levels in the blood. Use recommended milk substitutes without added phosphorus. Okay, is one way to lower the amount of phosphorus in the diet. Okay, so there will be times when the doctor will prescribe a type of medicine called phosphate binder. These binders are taken with the meals and snacks. Okay, so they reduce the absorption of dietary phosphate. They are frequently used in people with chronic kidney disease who are less able to excrete phosphate, resulting in an elevated serum phosphate. Okay. Other dietary management, so potassium restriction, so low potassium diet. Large amounts of potassium are found in certain fruits and vegetables, milk and yogurt, dried beans and peas, most salt substitutes, and protein-rich foods. So, bawal sila nito. Okay? Potassium levels can also rise between hemodialysis sessions and can affect the heartbeat. Now, eating too much potassium can be dangerous to the heart and may even cause death. Okay, so ito siya. Okay, another, medyo tridor din itong si potassium. That's why I really have to monitor for alterations in heart rhythm in your patient. Especially if you know that meron siyang problem in regulating potassium. Okay? Okay, we also have calcium and vitamin D supplementation, okay, to prevent calcium loss. Okay, the patient may also need to take phosphate binders and avoid eating calcium fortified foods. The doctor may advise to take a special form of vitamin D to help keep calcium and phosphorus levels in balance. Now, do not take over the counter vitamin D or calcium supplements unless recommended by the kidney doctor. Okay. Now, after hemodialysis, okay, so we have a high calorie diet. Okay, so the patient may have added extra calories from simple carbohydrates like sugar, jelly, jam, hard candy, honey, and soup. And other good sources of calories come from vegetable fats such as margarine, vegetable oil, and non-dairy creamer. Now, these foods can be used as free foods to give extra calories each day for weight gain and to restore energy. Okay, because no, especially for patients who are experiencing dialysis, they tend to manifest or exhibit weakness coming from a session. Why? Kasi nag-travel yung blood from its normal circulation to the machine and then back inside their bodies. Okay, so similarly to blood transfusion, dapat on close monitoring si patient during the entire dialysis session. Okay, so VS is life. Okay, aside from the vital signs, we also check for level of consciousness of the patient plus yung cardiac rhythm. So usually nakakabit sila sa cardiac monitor or meron silang standby na ECG monitoring. After hemodialysis, pwede na sila mag-high protein diet. So, they can give or they can receive lean meat, fish, poultry, dairy products, and eggs. Okay? So, contain proteins of high biological value. So, dialysis removes nitrogenous waste and amino acid losses are substantial. Okay? So, although natatanggal yung nitrogenous waste, the patient's amino acid also gets lost. That's why after dialysis, they need a high protein diet. Okay? Unsaturated fats and cholesterol-free diet. Okay? Rationale for this one, low cholesterol levels in the blood help slow down the progression of chronic kidney disease to maintain a healthy lipid profile. Next, also fluid and sodium restricted diets. Okay, so I already mentioned this one before. Okay, so for kidney patients, a rise in body weight and blood pressure suggests that the person is retaining sodium and fluid. And most persons or most patients with kidney disease tend to retain sodium and may benefit from a mild fluid restrictions. Okay, so to monitor this, definitely, meron silang order for daily weight monitoring usually at the end of the night shift like mga 7 a.m. Okay? And they also do abdominal girth monitoring. Okay, so I remember this one patient nung nag-work ako sa internal medicine na area. Okay, during my trainee year, um, ano siya, renal case siya, and then medyo bloated yung patient, as in grabe yung fluid niya in his legs and also sa abdomen. Okay, so to check for the effectivity of the management, we also do yung uh, weight monitoring and also abdominal girth, especially if your patient is experiencing ascites. So you want to check if the ascites is improving. So dapat every day meron siyang reduction in the reduction in the measurement ng abdominal girth. Okay, next, advise patients that foods such as flavored gelatin, soups, fruit juices, frozen fruit, juice bars, and ice milk contribute to fluid intake. So the patient must control the sodium and fluid intake until subsequent dialysis treatment. Okay, restriction of potassium to prevent hyperkalemia and hypertension. The restriction is usually necessary for persons treated with hemodialysis. Okay, and recommended intake depends on serum potassium levels, renal functions, medications, and the dialysis procedure used. Okay, so again, this is more on potassium. Okay, so what to avoid, what to reduce with regards to potassium. Okay, okay, next, phosphate restriction to prevent hyperphosphatemia. Next, we have supplementation of calcium and vitamin D to prevent renal osteodystrophy. Ayan, na-remember ko na yung term used sa insulin for the rotation of insulin sites. We do the rotation of insulin to prevent tissue uh, dystrophy. Okay? I'm just going to type in another term for that one. Okay. Okay, so once dialysis treatments begin, phosphorus restrictions and calcium and vitamin D supplementation becomes the standard treatment. Okay, some slides are quite redundant, so um I won't dwell so much on them. Okay. And then last slide for our CKD. After dialysis treatments begin, protein intakes are liberalized, phosphate binders become essential. Okay, so same detail. Okay, so next, okay, so slide number 61, a little over halfway na ta. Okay, so it's 9:25 for those students in 2G. You may already start leaving the room. Wala, 55 na. Okay, so let me pause recording for a while. Okay, so la, loobat pala yung laptop ko. Wait lang ha, kabit ko lang. Okay, so to continue, let's proceed with liver cirrhosis. Okay, okay, by definition, liver cirrhosis is a late stage of chronic liver disease. It gradually destroys the liver tissue, leading to scarring or your fibrosis. Now, in some regions and small areas of regenerated healthy tissue in others. Okay, according to the brain. Okay, so statistics-wise, in 2017, cirrhosis caused more than 1.32 million deaths, so 40,000 in females and 883,000 in males globally. And then yung pinaka-common cause nito is uncontrolled alcohol consumption. Okay, so medyo lengthy ito guys ha. Okay, so symptoms of your liver cirrhosis. Okay, so you're going to notice fatigue in your patient, easy bleeding or bruising. Okay, it's because yung mga clotting, ano, components of our clotting, yung mga clotting factors natin, pinoproduce ng ating liver. Okay, so this is why pag damage si liver, you would notice that your patient manifests or exhibits easy bleeding or bruising. Your patient may also exhibit loss of appetite, nausea, swelling in the legs, feet, or ankles. Okay, so edema. Okay, so just like your kidneys, itong si liver, it also contributes to the proper fluid balance in our bodies. Okay, and once na damage si liver, affected po yung fluid, yung distribution ng fluid in our bodies. Okay, there's also weight loss, itchy skin, yellow discoloration in the skin and eyes, that's your jaundice, fluid accumulation in the abdomen or ascites, spider blood vessels on the skin, redness in the palms of the hands, and for women, absent or loss of periods not related to menopause, and for men, they may experience loss of sex drive, breast enlargement or gynecomastia, or testicular atrophy. And then oftentimes, lalo na pag late stage liver disease, your patient may manifest confusion, drowsiness, and even slurred speech. Okay, this is because of hepatic encephalopathy. Okay, so in addition, in liver disease, there is an increased production of androstenedione by adrenal glands. So this leads to increased aromatization of androstenedione to estrogen, loss of clearance of adrenal androgens by the liver, and a rise in SHBG, resulting in gynecomastia. Okay, and then the occurrence of testicular atrophy and gonadal dysfunction in advanced cirrhosis is a well-known clinical event. Both testicular histopathological abnormalities and low levels of serum testosterone have been described in patients with alcoholic and non-alcoholic cirrhosis several years ago. Okay, so okay. Okay, so medical management, okay, so just general lang, I won't go into too much detail okay, kasi I want to focus on the dietary management. Okay, so we have appetite stimulants, diuretics, okay, so paihiin natin yung patient so that their fluid retention will be controlled. We also have immunosuppressants, lactulose. Itong si lactulose, this is given to patients with hepatic encephalopathy okay, to release or to excrete yung ammonia. Kasi itong si ammonia, ito yung nagkakos ng confusion sa kanila. Okay? Especially when it travels to the brain. Okay? It is excreted through the feces or through the feces. Okay? So yung excess na ammonia will be pooped out by the patient. Next, we have sodium and fluid restriction. And then we also have paracentesis. Okay, so this is a surgical procedure. Okay, this is an invasive procedure used to remove the excess fluid from the body of your patient. Okay, so next, nursing management assessment. We promote rest, improve nutritional status, provide skincare, and reduce risk of injury, and we monitor and manage complications. So for nursing assessment, we assess for bleeding, fluid retention, and mentation, or in other words, yung level of consciousness ng patient. Okay? Common tip that I remember no, during my NCLEX review, basta medical, surgical ang case ng patient, always and always, one of the things that you have to consider is the level of consciousness of the patient. Especially here in liver cirrhosis um, na may neurologic involvement because of the ammonia, yung nagkakos ng hepatic encephalopathy. Okay, so for bleeding, to check, we need to check the patient's skin, gums, stools, and vomitus for bleeding. For fluid retention, we do weigh daily weights and measurement of abdominal girth at least once daily. Then again, yung level of consciousness for mentation. Okay, aside from checking for level of consciousness, we also look for changes in behavior or personality. Let's say from well-oriented to confused. Okay, so once your patient gets confused, restless, yung bali nag-act siya um, out of his or her normal behavior, that will alert you to is hepatic encephalopathy. Okay. Next, we go to the dietary management. Okay, so we have high calorie diet. So we have the total energy requirement based on the resting metabolic rate for infection and malnutrition. We also observe high protein diet. So we give high biological protein from the protein of high quality products such as fish, poultry, and soy. To maintain nitrogen balance. Okay? It's also used for the synthesis of blood clotting factors, to normalize altered AA ratios in brain tissues, or your amino acid ratios in brain tissues, and to improve mental state. Okay, so those are the main objectives of the dietary management for liver cirrhosis. Aside from this, we also have low carbohydrates. So 50 to 60% of the TER, we give complex carbohydrates consistent from day by day and at each meal and snack to prevent hyperglycemia. Okay, saturated fats and cholesterol restricted diet. So we only give EFA, omega-3, MUFA, and PUFA food sources for less appetite and malnutrition to increase energy supply. Okay, so it's here on the monounsaturated fatty acids. Okay, so these are the healthy type of fat. Okay, so examples of your MUFA are almond, corn, sesame, peanut, grapeseed, safflower, and whole grain meat. For PUFA, we have walnut, sunflower, flaxseed, and poppy seeds. Okay, they also still have restrictions as to sodium and fluid restriction. Okay, so it depends on the serum sodium level of the patient. Okay, so we have the diuretic therapy. So if the serum sodium level is 128 mg per liter, we restrict fluid to 1,200 to 1,500. If the patient's serum sodium level is 125 mg per liter, we restrict fluid to 1,000 to 1,200 ml. Okay, so the main purpose of this diuretic therapy is to control ascites, di ba? Yung accumulation of fluid doon sa abdominal area ng patient. Next, we have supplementation of vitamin B1. So we drink large amounts of alcohol, which suppresses the appetite. Okay, drinking large amounts of alcohol suppresses the appetite. Now, for altered neurological and motor functions, because alcohol impairs memory, judgment, and coordination, and disrupts sleep patterns. Okay, so usually, no, basta liver cirrhosis na patient, they have vitamin supplements, particularly itong vitamin B complex. Okay? Alcohol also interferes with the absorption of thiamine in the GI tract. So when used long term, alcohol may cause permanent brain damage. So yung mga patients who are into alcohol abuse, medyo nagiging slow sila. Okay? And they also have alterations in ambulation, okay? Yung walking nila. Okay? And yung they tend to be confused. Okay? So may mga impairment sa brain function nila. Okay? Oh, okay. Okay, sorry, I just saw your message. Okay. Next, okay, so management. So we have other suggestions on how to increase energy intake of the patient. If the restriction is necessary, make sure that the patient is fully understands how to modify the diet so that the food intake is not restricted unnecessarily. We also provide lists of acceptable foods and menus. We explain how to modify their favorite foods to become therapeutic for them. Okay, so it's more on giving health teachings as well. Okay, we suggest between meals, snacks during the day, and a snack at bedtime. Oral supplements such as Ensure can substitute for snack and requires no preparation. Itong C2 dapat no preparation po ito. So the patient should consume snack within 2 hours before meals to reduce appetite at meal because it may reduce appetite at mealtime. Okay. Wait lang ha. Mag-open muna ako ng door. Okay, wait lang ha. Okay. So if the patient has little appetite or is quickly satiated or full, then you may suggest foods that are higher in energy content. Okay, so recommended energy boosters. So we have the following. So for water, give fruit juices or fruit nectars. For vegetable and potatoes, we use polyunsaturated fatty acid salad dressings. For sandwiches, again, yung PUFA na mayonnaise. For casserole and meatloaf, we add hard-boiled eggs. For crackers, we may use peanut butter, the old-fashioned type of peanut butter. Okay, we also have salads. So cooked cereals and bakery products. For these products, you may add chopped nuts or walnuts. So ito sila yung mga examples of energy boosters. Okay. Okay, next we have peptic ulcer. Okay, so for peptic ulcer, but oh my gosh. Wait lang. Hala, oy, nag-lag konti yung PowerPoint ko. Wait for a while. Ayan. Okay. So by definition, peptic ulcer is an excavation or hollowed out area that forms in the mucosa of the stomach, in the pylorus, the opening between the stomach and duodenum, in the duodenum or in the esophagus. So erosion of a circumscribed area of mucosa is the cause. So may mga butas-butas yung ating stomach. Okay. Oh, okay. Just to zoom in on this one. Yan. Okay, so erosion. Think holes in your stomach. Okay, so the erosion may extend as deep as the muscle layers or through the muscle to the peritoneum. And this may be referred to as either gastric, duodenal, or esophageal ulcer. Okay, so depende sa location ng ating ulcer. Now, this is more likely to occur in the duodenum than in the stomach. Okay, so signs and symptoms, so dull, knowing pain or burning sensation in the mid, epigastrium, or the back. The patient may also manifest nausea, okay? Pyrosis, vomiting. So this is rare and uncomplicated. Usually symptoms of this is usually a symptom of complicated peptic ulcer. So itong si pyrosis, basic understanding for this one is medyo burning type na vomitus. Pyrosis, vomiting. Okay? From the word pyro. Okay, heated na vomiting, or rather it is a regurgitation in some of the stomach contents that travels back to the esophagus into the mouth, and it's similar to vomit but it comes up in liquid form and leaves a bitter or sour taste. So bale yung mga acids po ang na regurgitate. Okay? So we also have sour irritation or burping, epigastric tenderness or abdominal distension. The patient may even exhibit either constipation or diarrhea. There's also bleeding, severe, or through hematemesis or melena. So there are times na we get patients who are admitted because of peptic ulcer, but then late sign na. nandyan na sa late stage. Okay, so nag-reach sila sa point ng bleeding. Okay, it's either yung usually yung pag-vomit out ng blood or what we call as your hematemesis. Pag nakapoops ang patient tapos may halong dugo, that's what we call melena. Okay? Now, other signs and symptoms of perforation. Okay, so further destruction or further erosion um, ng ating duodenum. Okay, so sudden severe upper abdominal pain, persisting and increasing in intensity, vomiting, the act of collapsing or fainting or syncope, extreme tender and rigid board-like abdomen, and hypotension and tachycardia, indicating shock. Okay? So ito na yung signs and symptoms signaling yung further progress or further injury ng injury caused by the peptic ulcer. Okay, medical management. Okay, just to give you a general overview of the drugs used to treat peptic ulcer. Okay, so we have antibiotics to eradicate your H. pylori. Ito yung causative agent ng peptic ulcer. Okay, so it could either be amoxicillin or clarithromycin, H2 blockers such as ranitidine and proton pump inhibitor, or omeprazole. So they will help normalize the stomach acid levels. Okay, avoid the use of aspirin and other NSAIDs. Why? Because you would want to prevent further bleeding. Okay? Next, smoking cessation. So itong si smoking is also common in a common associated factor with peptic ulcer. Okay, kasi nakaka-cause din siya ng hyper acidity, itong si smoking. Okay? Next, dietary modification, surgical management if the peptic ulcer is severe and complicated. Okay? So in addition, yung additional no, yung side notes natin, smoking decreases the secretion of bicarbonate from the pancreas into the duodenum, resulting in increased acidity of the duodenum. Okay, so in short, itong si smoking nakaka-trigger siya ng further acidity. And then further acidity or the more acidity, then the worse your ulcer gets. Okay, so next, nursing management. So we advise the patient to adhere and complete the medication regimen to ensure complete healing of the ulcer. Meals should be eaten at regularly paced intervals in a relaxed setting. Okay, so slow, frequent feeding as much as possible. Okay, hindi din sila pwede mag-take in ng heavy meals kasi all the more na matrigger yung kanilang peptic ulcer. Learn relaxation techniques to help manage stress and pain. Advice to adhere dietary restrictions and cessation of cigarette smoking. The immediate correction of blood loss may be required to prevent hemorrhagic shock for severe bleeding and monitor vital signs. Okay, so I would also like to mention na yung 'di ba severe irritation or increased burping plus yung incidence of hyperacidity. So these are indications, this could also be indications of stress din. Kasi we also have instances wherein yung sobrang stress can cause our peptic ulcer. Okay, so we have to tone down or to at least do proper stress and anxiety control for this one. Okay, so me personally, no, I tend to have a lot of hyperacidity attacks. Okay, so for those who are using earphones or headphones from time to time, I'm sure na narinig ninyo yung pagka-burp ko. Okay, so that's actually an indication ng hyperacidity. Okay, so back then, especially when I was attending grad school, all the more na trigger yung aking hyperacidity. Like there was this one professor na medyo mataas yung standards niya, tapos medyo din kanang toxic sa mga requirements, especially sa reporting. Natitrigger talaga yung hyperacidity ko back then because like every slide of my 68 slide report, na mag ano talaga siya, magbigay siya ng magbigay talaga siya ng ano, input or comments. Okay, so yung PowerPoint presentations ko sana na for 1 hour lang naging 2 hours and a half. Okay, so imagine nyo lang yung stress. Okay, so during that time, talagang activated yung hyperacidity ko. Yeah, I think, okay, I think, ano, um, candidate din ako for ulcer with regards to this. Okay, so I cannot further stress the importance of proper relaxation technique to help tone this down. Okay, so 'di ba I mentioned ano, it's really common for me na ma-hyperacidity plus mag-increase burping. Okay, so this was something that I had to deal with din when I had my and when I had my NCLEX. Okay, so literally during the exam to keep my mind off of having hyperacidity. Kasi yung problem with my hyperacidity is I also tend to get dizzy. Nagka-cloud yung aking judgment. Okay, so what I did, relaxation technique talaga. Nag-breathing technique jud ko every question. Okay, and it also helped na nag-earbuds ako or nag-earplugs ako so that I will not hear the noises or breathing sounds of my fellow test takers. Kasi makatabi nga kami. We were only separated by cubicles doon sa exam venue. Okay? And then another important thing for those people who are dealing with ulcer or even yung mga hyperacidity, they really have to eat regular meals. Hindi sila ang type na hindi pwede yung fasting kasi all the more na trigger yung kanilang hyperacidity. So another thing that I did before my exam, I had a heavy breakfast before going to the exam venue. Luckily, my pancake house malapit doon sa building where my exam was to take place. Okay, so um, very essential again yung relaxation technique, regular meals in a relaxed setting. Okay, why pancake house? Because for me, it's one of my comfort places. And especially whenever I would go out with my nephew, ano man po siya, kana medyo social po siya taste. Kung maglabas kami, hindi siya pwede sa Jollibee, mga common good. Yung gusto niya talaga yung mga medyo mahal na mga resto. So, pancake house, jud mi mag-date. Okay, so, it's a comfort place for me. So, nakaka-help din siya sa um, pag-promote ng relaxation before the exam. Okay, so that's the same principle, same health. These are the same health teachings that you can also give to your patient with peptic ulcer. Okay, bawal stress, dapat relax siya, tapos hindi dapat ma-trigger yung kanyang hyperacidity. Kasi all the more na mag-experience siya ng pain and discomfort for that one. Okay? Next, advised on here, dietary restrictions and smoking cessation. Self-explanatory. Immediate correction of blood loss may be required to prevent hemorrhagic shock. Okay, so expected yung blood transfusion. Okay, no other procedure that can help treat blood loss but blood transfusion. Okay, especially for severe bleeding. Okay, and definitely monitor vital signs to evaluate the patient for shock. Okay, so tachycardia, hypotension, and tachypnea ang i-watch out for. Okay, so dietary management for peptic ulcer, chemically bland diet. So this consists of foods which are chemically non-irritating and least likely to irritate the GI tract. So we allowed foods that are mild in flavor, non-stimulating or any food tolerated by the patient. So as for food restrictions, hindi sila pwede sa black pepper, chili powder, hindi sila pwede mag-pepper lunch. Okay, so they're also not allowed to have chocolate and strong coffee and alcohol because these are gastric irritants. Okay, so no ito sila. black pepper, chili powder, chocolate, strong coffee, and alcohol. Okay? Yung sa alcohol kasi, this will the presence of alcohol will further increase acid secretion, therefore irritating the GI lining. Okay, so this is the essence of your chemically bland diet. Aside from this, we have high fiber diet. So foods that are high in soluble fiber includes oats, psyllium husk, legumes, flax seeds, barley, nuts, and certain vegetables and fruits such as oranges, apples, and carrots. Fiber can also lower the amount of acid in your stomach while easing bloating and pain. Next, we have vitamin A rich foods. So these include liver, carrots, broccoli, sweet potatoes, kale, and spinach. Okay, so natural foods that are deep yellow and orange are rich in vitamin A. Why vitamin A? Because it increases the production of mucose in the GI tract, and it also has a protective effect against the development of ulcer disease. Okay, so yan yung significance ni vitamin A. Next, we have flavonoid-rich foods. So they include garlic, onions, colorful fruits and vegetables such as cranberries, strawberries, blueberries, broccoli, carrots, and snap peas. And this is basically to inhibit the growth of H. pylori, the causative agent of your peptic ulcer. Okay. Now, another function of your flavonoids is that they are rich in antioxidants and can help your body ward off everyday toxins. So, pang-detox siya. And um, ano siya? H. pylori is a type of bacteria. Again, your causative agent for your peptic ulcer disease. Now, specific management, okay, the magical cranberry juice. Okay, so drinking just 250 ml cups of cranberry juice might reduce the risk of H. pylori overgrowth in the stomach. Okay, so cranberry is acidic in nature, and bacteria, they hate acid. Okay? Namamatay sila in an acidic environment. So, di ba, pag UTI, we also have that management na let the patient have cranberry juice. Kasi namamatay yung causative agent ng UTI in the presence of an acidic environment. And your cranberry juice can provide that. Okay? Okay, so when antibiotics are used to eradicate infection, the bacteria may mutate and become resistant to treatment. So another function of your cranberry juice is that it helps by either not allowing the bacteria to attach itself or by disengaging it from the body once it is attached and prevent inflammation. Okay? Okay, so coffee and alcohol. So these are both caffeinated and decaffeinated coffee can increase acid production and exacerbate symptoms in individuals with ulcer disease. And alcoholic beverages can erode the protective mucosal lining along the GI tract and lead to further inflammation and bleeding. Okay, so the key thing to remember is that they should either limit or avoid both coffee and alcohol. Okay, so ito yung pinaka dapat i-remember for your dietary management. Okay, next, assess individual tolerance. So it's important to find out what works for the patient. So if you notice that the symptoms get worse after eating certain foods, then the patient should limit or avoid them altogether. Okay, without eliminating the entire food group. Small meals may be better tolerated than large ones. Patients should avoid food consumption for at least 2 hours before bedtime to properly digest the food and avoid gastric acid secretion. Okay, that is why, no, like for those na medyo mahilig mag-take ng midnight snack, when you try to fall asleep, it's quite difficult to fall asleep. Why? Kasi na-activate na yung stomach ninyo. Okay, so nag-produce siya ng um, and for more gastric acid. Okay, so you have to make sure that 2 hours, at least 2 hours before bedtime, dapat dyan na yung last meal ninyo. Okay, do not take any food right away before um, bedtime. Kasi all the more na mahirap. Nalagi baby. Hi.
Hi.
Hi, baby. Alam. Okay, cute lang ha. Okay. Hala, kuya, mao yung jargon, no? Basta, no, pediatric, basta pedia. Yung mga toddlers and preschoolers, na jud sila own language or own terms. Ano din nga, okay. Okay, so to continue, okay, again, dapat they have to eat their last meal at least 2 hours before bedtime. Kasi all the more sila na mag-produce ng more gastric acid. Okay? Okay, next we proceed to pancreatitis. Okay, so by definition, I think this is the uh, third to third to the last. Okay, pancreatitis is an inflammatory disease of the pancreas. So we have acute and chronic. In acute, the digestive enzymes within pancreatic cells become prematurely activated, causing destruction of the pancreatic tissue and subsequent inflammation. Ito yung nangyari sa matini idol na si Rico yan. Okay, so 90s kids can relate. So next we have chronic pancreatitis. It's the progressive permanent damage to pancreatic tissue resulting in the impaired secretion of digestive enzymes and bicarbonate. Okay, so this can be caused by gallstones or alcohol abuse, elevated blood triglyceride levels, and or exposure to various toxins. Okay, so ang nangyari kay Rico yan, yung ex ni Claudine Barreto, was siya ka ng eve of Good Friday or Good Friday na nag-party-party sila plus nag-inom-inom sila doon sa resort sa Palawan and then natulog agad si Rico yan. Okay, and then the next morning hindi siya unarousable siya. Like literally hindi siya nakagising, okay? From that night of eating, partying and drinking. Yung pala he experienced acute pancreatitis. Okay? So symptoms, the patient will exhibit severe abdominal pain, nausea and vomiting, abdominal distension, fever, and jaundice. Okay? So just to add, yung sudden severe abdominal pain, this pain may radiate to the back and may last for several days. The person may find that the pain is relieved by leaning forward or sitting up. And the patient may also experience the other following symptoms. So um, in most patients, the condition resolves within a week with no complications, and more serious cases may lead to chronic pancreatitis, infection, the systemic inflammatory response syndrome, or multiple organ failure. Okay, so a major complication from chronic pancreatitis is diabetic mellitus. Kasi di ba, once damage si pancreas, impaired din yung insulin production. So that's another way for diabetes mellitus to arise. Okay. Okay, so for nutrition therapy, initial treatment is pain control and intravenous hydration. Now, for mild to moderate pancreatitis, oral fluids and food are withheld until the patient is pain-free and experiences no nausea and vomiting. And then afterward, a regular diet or a fat-restricted diet. Okay, so yung sa scenario good ninyo, yung case ng patient is nandun na siya at home and he or she is simply trying to live with the effects of the disease. Okay, so hindi siya NPO ha kasi if NPO ang diet ng patient, wala kayong ma-prepare na meal or finished product for your patient. So just have to take note of the dietary guidelines. Okay, the things that the patient can eat and the things that the patient cannot eat or ingest. Okay. In severe pancreatitis, continuous tube feedings should be started within the initial 48 hours of treatment. Use of elemental formula. So protein needs are generally high in pancreatitis patients. Okay, due to the catabolic effects of inflammation. So, nade-destroy yung protein reserves nila. That's why they need more protein. Okay? Patients should be given multivitamin supplements until food intakes can be met. And vitamin B12, iron, and folate are most likely to be affected in the malabsorption problem. So, as a result, you would expect your patient to have supplements for vitamin B12, iron, and folic acid. Okay, so that's for your pancreatitis. Next, you have celiac disease. Okay, so medyo mag-fast forward lang ako dito kasi we already discussed this back in the midterm, di ba? We went through diseases in childhood. Okay? So for celiac, again, this is it's a digestive and multi-system disorder. It's a complex immune-mediated disorder which the immune system causes damage to the small bowel when affected people eat gluten. So basically, yung diet ng mga celiac patients is gluten-free or dapat bawal sila mag-take ng gluten-containing foods. So signs and symptoms, delayed growth in children, decreased appetite, bloating and gas, discolored teeth, fatigue, and anemia. Okay, so this happens because the small intestine cannot absorb nutrients from food. So GI disruption talaga. Okay, so they may also exhibit headaches or migraine, itchy skin, depression, liver disease, constipation, and anxiety. For dermatitis, herpetiformis, this is a skin rash caused by gluten consumption. So it's usually, but not always, one of the itchiest rashes you'll ever experience. So lesions can sting and burn as well as itch. So lesions can appear anywhere, but occur most often on the elbows, knees, buttocks, lower back, and back of the neck and head. Okay, so tingling, numbness, joint pain, infertility, diarrhea. Okay, so since we know that celiac disease is an inflammatory type of disease, you would notice that your patient will experience redness, swelling, and joint pain. And due to malnutrition, your patient may suffer from infertility. For medical management, simply lifelong gluten-free diet. No sa kanya yung mga gluten-containing foods. Okay, so bawal siya ng wheat, rye, barley, and all forms. Okay? Purely diet management po sa celiac disease. Okay, so this allows the small intestine to heal so that it can absorb nutrients properly and reduces the risk of associated problems. Okay, so monitor dietary intake, fluid intake and output, weight, serum electrolytes, and hydration. Make sure that the diet is free from gluten, the causative agent, but it should contain essential nutrients such as protein, fats, vitamins, and minerals. Maintain NPO status during initial treatment of celiac crisis or during diagnostic testing. But when these are done, pwede na magkain si patient. But make sure na gluten-free. Okay? Provide parenteral nutrition as prescribed. So, if hindi makatolerate ng food si patient, then IV is the way to go. Okay? Provide meticulous skincare after each loose stool and apply lubricant to prevent skin breakdown. Encourage small frequent feeding. Use hand washing to prevent transmission and infection. Very self-explanatory. Assess for fever, cough, irritability, or other signs of infection. Teach the parents to develop awareness of the child's condition and behavior. Recognize changes and care for child accordingly. Explain that the toddler may cling to infantile habits for security. So allow this behavior as it may disappear as physical condition improves. Kasi usually, celiac disease happens among toddlers. Stress that the disorder is lifelong. However, changes in the mucosal lining of the intestine and in general clinic conditions are reversible when dietary gluten is avoided. So ito yung number one rule. No si gluten. Okay, so wheat, rye, barley are not allowed. Okay, so ito yung pinakamadali ma-remember from all the non-communicable diseases that I've presented. Okay, so this one, I think I also mentioned this one last grading period, so I won't dwell on this one. Okay, so you can just simply read this on your own. Here we have a sample one-day meal plan for celiac sprue. Okay, same here. You just go over this on your own. And last but not the least, again, mag-fast track na lang ako nito. Phenylketonuria, although we already discussed uh, major parts of this. Okay, so just as a recap, it is known as PKU, a disease in which individual lacks the enzyme phenylalanine hydroxylase. Okay, so without this enzyme, a dangerous buildup can develop, and that is how the patient ends up with phenylketonuria, PKU. Okay, so high levels of phenylalanine in the blood are toxic to brain tissue and can result in mental degradation and possible death. That is why if you're assessing a patient um, with PKU, tapos medyo pronounced na yung mga characteristics niya, one of the number one things to watch out for is yung alterations in level of consciousness, okay, and cognitive functioning. Okay, so we already discussed this last grading period, yung mga signs and symptoms niya. Okay. Next, for medical management, phenylalanine-free formulas, restricted diet, amino acid supplementation, avoidance of aspartame, gypsapropterin, and enzyme therapy. Now, for nursing management, for diet, inform family caregivers of the foods that they should avoid. Special formulas are also indicated instead of regular formulas, such as lofenalac and phenyl-free formulas. We also have emotional support, so offer support to the family after the diagnosis so that they could cope with the shock and anxiety and stress. Wala, oy, sorry, nagbark akong dog. Okay, we also have health education, counseling from dietitian, and safety. Kasi yung pinaka-danger ng ating PKU is neurologic involvement. Okay, so pag medyo late sign and progression of the disease, your patient may exhibit seizure activity. Okay, so when it comes to this, you just simply have to properly educate the patient's family, okay, and in terms of properly identifying signs and symptoms of seizure activity. So they have to be taught then on how to practice safety around the patient with an active seizure. Diet-wise, low protein po tayo, phenylalanine free or restricted. Okay, so here are the examples of some foods. So meat, fish, cheese, eggs are rich in protein and therefore phenylalanine. So any foods that are rich in protein, automatic na rich din siya sa phenylalanine. So not allowed sila. Other foods which contain some protein such as potato, milk, and cereals are given in small measured quantities. Okay, so small. Small is good. Okay, so which is measured regularly is kept within safe limits. Kasi miserable din si patient if wala na siyang makain. Okay, so they have to modify or adjust, okay, according to the needs of the patient. Next, for most fruit, some vegetables and salads can be taken in normal quantities but avoid excess use. Sugar, jam, syrups, and fats such as butter and lard and cooking oil can be used freely. Next, as high protein foods cannot be eaten, these have to be replaced by special protein mixture from which the phenylalanine has been removed. Vitamins and minerals should also be supplemented. The patient can also have specially formulated low protein wheat based products, including bread, flour, biscuits, and pasta. Okay, so they can be purchased through the pharmacies or special stores. Okay, so traffic light system for PKU sources. I think I already went over this last grading period, yung red, amber, and green. Okay, basta red. These refer to foods that should not be eaten. Pag yellow or orange, the patient may eat those food items, but do so cautiously. Okay, and then green, this stands for go. So these foods may be eaten in normal quantities. Okay, so just go over this when you have your slides to yourselves. Okay, amber. Okay, so ito yung mga foods under each alert. And this is the for green. And then lastly, okay, we have vegetables, miscellaneous food items in relation to your PKU. And then for special formulated low protein products, ito sila. Okay, so just go over them when you have your slides. Okay, so sample 1 day meal plan for PKU patients. So as an inspiration or as for you to have an idea on what to prepare. Okay, so yun.